So hello everybody, thank you for joining us. I'm so pleased to be able to talk to you this evening about the WholeLife project. It's a unique community-based healthy lifestyle course which my colleague Jenny Corser, a GP partner and the PCN clinical director, has persuaded our PCN to fund. It was launched in November 2020 and has proved very popular with our patients, as well as attracting participants from outside our PCN boundaries. Jenny will tell you a bit more about the logistics of setting it up later on in the presentation. But first, I'd just like to show you an introductory video that we created for our project. So you should hear and see this video in just a few seconds.
Welcome to WholeLife. You may be wondering who we are. We're a group of GPs, dietitians and health coaches who work alongside patients to help them lead longer, healthier and happier lives. We are based in glorious green Devon in the coastal towns of Teignmouth and Dawlish. Our approach is to follow the medical evidence, and this has led us to 3 principles of a healthy life: a whole food, plant-based diet, daily activity in our lives come rain or shine, and meaningful connection to ourselves, our family, our community and our planet. We've come to understand that much of our ill health as a nation is due to a lifestyle that we can change, and it is never too late to change our habits and to see a real benefit. The course lasts for 7 weeks, where we come together to learn how and why we should make these changes a way of life that will naturally lead to the reduction in our weight and reduce the risk of diabetes, heart disease and cancer. We will be with you every step of the way while you make these changes and help you overcome the barriers that you may face, changing your life for the better. If you're interested in joining us, then contact your GP if you live in Dawlish or Teignmouth. Or alternatively, go to our website at www.wholelifeplantbased.com.
Right, I hope you enjoyed that. That was put together by one of our very talented GP registrars who's with us for 6 months and worked on the WholeLife project with us. So a bit of background about this project. I want to talk to you about the burden of chronic ill health, which is well researched and documented. Globally, non-communicable diseases are the cause of about 41 million deaths every year and 15 million early or premature deaths. The burden is spread disproportionately across the globe, with about 85% of these premature deaths taking place in low to middle income countries. And what's more, just 4 main groups of chronic disease account for over 80% of all premature deaths from disease. These are familiar to us in the UK, and most of us working in healthcare spend a great deal of time and resource caring for people who have well-established illnesses and multiple comorbidities from them. But these chronic diseases are not inevitable occurrences in individuals' lives because they're largely driven by our lifestyles, as you can see from this slide. The World Health Organization's research lists just 4 behavioral and therefore modifiable risk factors implicated in over 16 million deaths annually. That's smoking, salt intake, alcohol intake, and physical inactivity. In 2017, the Global Burden of Disease study published in The Lancet found that just 3 dietary risk factors are implicated in 11 million deaths every year and 255 million daily adjusted life years. That's the number of years lost to poor health across the globe. These are compelling data and are a reflection in part of the ills within our global food production system. Here in the UK, the data tell the same story. These findings from the 2010 Global Burden of Disease study put a spotlight on our diets, showing numerous dietary risk factors playing a part in the development of chronic disease and its consequent effect on our quality of life. So you can see that 9 out of the 20 leading risk factors here relate to our diets: diet low in fruits, nuts and seeds, diet high in sodium, low in vegetables, etc. So these health burdens linked to chronic disease have been all the more highlighted during the current COVID-19 pandemic, This slide shows the results of a study that showed that the vast majority, 77%, of those unfortunate enough to be admitted to hospital with COVID disease had underlying chronic disease. And according to the UK government statistics, 87% of people dying from COVID-19 had at least one underlying chronic disease, often two, showing just how vulnerable this group of people is to the ravages of this pandemic. Obesity has been a worrying problem in healthcare systems for decades, but again, the risk to health that obesity poses has been highlighted by this pandemic. This slide demonstrates some of the risks that being overweight or obese carries in the face of contracting COVID-19, with those in the highest BMI category having 6 times more likely risk of being hospitalized with the disease. And yet, obesity rates continue to rise inexorably, with 62% of UK adults presently being either overweight or obese, and 28% falling into the obesity category. The UK has the highest rates of obesity in Europe. The COVID-19 pandemic in some ways can be thought of as the perfect storm, with a host of factors intersecting with each other to create unique challenges to the health of our population. Many people have expressed the wish to face up to these challenges in the post-pandemic area in the phrase "build back better," which I think probably many of you have heard politically and otherwise, recognizing that this could be an ideal time to restructure our systems, to change our physical environments and our organizations to mitigate the effects of this so-called storm. For example, we've seen this government promote active transport, trying to get people to walk or cycle, and just be more active, by funding local governments to change road systems, public transport, to encourage people to do this instead of driving. The inequalities within UK society have also been highlighted by the pandemic, with people from Black and mixed ethnicity background being more vulnerable to the disease. Our planet's health has also come to our consciousness, not only from the red alert calls from international scientific community about global heating and climate change, but also from our lockdown experiences of seeing firsthand that nature can thrive when we slow human activity down. And it's well recognized that healthcare systems alone bring limited improvement to our population's health. There are broader determinants of health that are more influential, such as housing, air pollution, financial security, etc. So this is a slide that demonstrates that healthcare in 3 different studies makes up just a minority proportion of the determinants of our health. So where does all this fit into primary care, given that our efforts within the healthcare system to improve our patients' health have such a limited effect? There are tools being used now to effect change on people's behaviors, to try to improve our care of people with chronic illness. For example, the Primary Care Quality and Outcomes Framework, QOF system, has offered incentives to standardize good care in many of the chronic diseases, but these are blunt tools, limited to individual surgeries with varying results. The recent formation of primary care networks and integrated care systems promotes collaborative working amongst healthcare and community organizations, and it seeks to integrate the powers of these different systems to bring about improvements to population health from a wider perspective. This restructuring also prepared the ground for the introduction of personalized care plans in an effort to support people with complex health and care needs and help them to improve their health. This wider approach recognizes the importance of these wider determinants of health. The WholeLife program is an example of a program attempting to address the health of the local population from behind that wider lens of just primary care systems. And it starts with our biggest health question: how do we prevent these long-term conditions from starting in the first place? How do we help people live as long, happy, and active lives as possible? What changes do we need to make 15 to 20 years earlier before people start becoming ill? Is it a pill, an exercise, diet, lifestyle, or combination? And that's the basis upon which WholeLife has been founded, essentially. It uses the foundation of 3 essential things to build good long-term health behaviors: a healthy diet, and unsurprisingly for this audience, that would be the whole food, whole grain, plant-based diet, regular and preferably daily physical activity, and good social connections with a sense of purpose. The project started with a pilot back in 2019, recruiting about 100 people from within the local healthcare community to participate in a 4-week challenge. In this challenge, participants agreed to eat a 100% whole grain plant-based diet, to increase their physical activity, aiming for the UK exercise targets, and to take part in social activities organized by the project team. For example, a wintry walk in the cold January debonair, followed by some plant-based food in a local cafe. Some of the results in terms of health measures were amazing. For example, blood pressure measurements dropped for most, with many people reaching normal blood pressure. So the green expanded. People with normal blood pressure, that proportion got bigger as people shifted over more towards from high blood pressure to normal blood pressure. For most, adopting a 100% plant-based diet resulted in weight loss, even for those with a starting BMI in the healthy range. Participants are told that they can eat as much as they like. There's no calorie counting or restriction here, and nobody gained weight with this approach. You can see here that the higher their starting BMI, the more weight they lost. For most, this was very welcome, although not necessarily their goal. The pilot encouraged further development of the project leading up to its launch. Jenny will be saying more about that particular journey later on. I'll also show you some results that the project has achieved since its launch a bit later on, but just to say now that they're pretty similar to what was found in the pilot. Here's our team. We are a small team, and we are 5 permanent team members. Dr. Vicky Tilney is the talented GP trainee who helped us with that video, amongst other things. So we do have people come and go and help us out, but basically we are a team of 2 dietitians, an administrator, Vicky, myself, and Dr. Corser. So this just reminds you of our foundations of the project. And this is what we offer. We offer a 7-week education program. It started off as Zoom because we were mid-pandemic, and it's carried on like that. It may become offline or in person at some stage, but too early to do that just yet. So within that 7 weeks, we asked them to adopt a 4-week challenge of a whole grain plant-based diet. And we give them support from ourselves throughout, to groups in the sessions and to individuals. They do blood tests pre and post course to get some data on health improvement, although that's not our focus. We're not a research study. And the peer support through the social media, we use Facebook private groups, through the in-course group works using breakout rooms, for example, and through outdoor social events and walks that carry on once a month roughly. All that is offered in the course to support them make their changes. Here's what we cover in the course roughly. So we present the latest clinical evidence, of which there are reams and reams of it, regarding the lifestyle factors in the development of chronic illness and how a plant-based diet can change their course. We offer motivational tips and techniques, lots of nutritional education. It's surprising how much we have to go back to basics on that and how much that's appreciated. We offer health facts about exercise, social connections, sleep, and we have a session that has proved to be very popular about food and the environment, the facts around the industrialized food system globally and its contribution to the current climate and ecological emergencies. This is just an example of some of the evidence that we present in just one tiny bit. Jenny spends the first session presenting all the evidence, and this is one of the Adventist Health Studies course that from which we present a lot of evidence. So the participants seem to lap up this kind of thing. They really love hearing about this. And this is also a slide from one of our sessions about the environment. So we do show them the effects of what would happen if we kept going with the current food system, business as usual, and what would happen to the carbon emissions and the consequences that would have for our planet. And we talk to them about, changing the diet globally, the global diet, from the standard processed food that it is now, meat-based, to a plant-based diet, and what would happen, what could happen to our carbon emissions and our planet's health if that were to happen worldwide. So there's a big emphasis on planetary health as well. We present the Lancet Eat Well Planetary Health Plate, which probably a lot of you in this audience may well be familiar with. The plate that's capable of feeding a predicted 10 billion population by 2050, while reducing our greenhouse gas emissions to hopefully maintain global heating below 1.5 degrees Celsius. Some of you may know a lot about that and realize that perhaps we are already past that point, but this is worth a try. It's scientific consensus. So who are our graduates? Well, all sorts. The majority have been overweight or obese and are joining it partly for weight loss, but it's not a weight loss program specifically. Some have multiple long-term conditions and polypharmacy. Some are already athletes competing in amateur sports, such as triathlons. And we recently presented, just last night actually, our first sports nutrition session, an add-on to the program. Some are completely new to exercise. The majority, however, were eating the standard Western diet of primarily and majority processed foods, although some were already mostly plant-based when they did join. So the results we've been getting across the 6 Finnish groups that we have had results collected for, that's about 91 participants have completed our course now. And you can see the results have been pretty good. Blood pressure does drop significantly. Weight drops, almost everybody loses weight. Cholesterol and HbA1c have variable results, but the average drop is not too bad, 4% in that, and in HbA1c, but they're not really. Many of them are pre-diabetic, some are diabetic. In fact, the biggest weight loss wasn't in somebody with diabetes, but it was a pretty substantial 9 kilos over 7 weeks. Biggest drop in HbA1c was amazing. That was in a patient who was recently diagnosed with diabetes and just did not want to go on medicine. And you can see it dropping from 106 to 83 in just 7 to 8 week period is absolutely amazing. And some were able to actually reduce their medications. And then we do pre and post surveys before, immediately after, and 6 months later. Again, 100%, they all complete the course once they join. Once they start, they finish. They love it. They always give us 100% feedback saying they really loved it. They'd recommend it to their friends and family. They rate their health before and after. So this shows, that they're rating it from 0 to 10, 10 being really good, 0 being rubbish. And it switches from before and after. Everybody kind of shifts up that scale. These are survey results taken from different groups, so it's not an average or anything. It's just, but most groups do show that similar shift of them rating their health. They all feel healthier and better, or most of them. And then this is why they feel they have more energy, they're more active. The social connection side of things, it's a bit more tricky because that's so multifactorial there, but we're working on that, and they do appreciate the efforts and the peer support in that. And again, they lose weight. This, I think, is a result of our first available 6-month post-course survey, and I was really pleased to see this because all of them that responded, okay, 7 responses, not great hit rate, but the ones that did respond are keeping on with the whole life diet, either some of the time or most of the time. So nobody all the time, but it's a big change from where they started. And pleasingly, they're not really eating much red meat any longer. We educate them about the dangers of that. And even more pleasingly, they have either maintained the weight that they lost, or lost even more. This is a 57% of these 7 respondents did say that they continue to lose weight. So, and then the feedback we're getting from individuals, it has been really great. And we picked this one out to show you this little video of one of our participants in a group a couple of months back, Paul, who was so enthusiastic. I think he's the one that lost the most weight. So I'm just going to play you what he's had to say. And apologies for the sound. It's because he's standing outside in local where we live on the beach, getting ready for a swim, and it's a bit windy. So,
well, if you've just signed up for the WholeLife challenge, your life is just about to change for the better. I've just completed the last WholeLife challenge. When I started, I was just over 100 kilos. I'm now just over 85. The education, the support you get from the team that run it is absolutely superb. But like anything you do in life, there has to be an element of enjoyment. If you get on a train and you don't like it, you're going to get off. So you can enjoy this. We've all probably tried diets in the past, never worked really. We've knocked the weight off and then we put it straight back on again. But with the re-education of the right food to eat, I actually found it really enjoyable. And as it's only just me, I enjoyed it. But anyway, that's enough for me. Enjoy the challenge. Believe you me, it's interesting and it's very educational. I'm off for a swim now, out to these boats behind me. Enjoy the challenge.
I don't know if you caught that, but Paul said at the end that he was going to swim out to the big tankers that are out in the bay. He was one of our star participants, if you like, because of the peer support. He was one of the motivators in the group. It kept people going to have someone like that be so enthusiastic and joining all our social events, and he's always around and participating. So that's the conclusion of my part of the presentation tonight. So I'm just going to now hand over to my colleague, Jenny, who's going to tell you more about the logistics of things.
Hi everyone, I'm Dr. Jenny Corser. I'm Jenny Corser. I'm just going to share my screen with you. So give me a moment. Start my slideshow. Oops. Hopefully you can all see that. Right, so thank you so much, Jane, for explaining the WholeLife program so in such a lovely way with all the evidence. Jane's put so much work into that presentation, and I've got the easy bit by comparison. So what I was going to do is hopefully be able to answer some of the questions that you may have about how it all started. So you might be looking at this and say, how on earth did we get this through on the NHS to the network where we are? So I wanted to tell you a little bit of details regarding that. So, and some of it starts with my story. So if you don't mind, I will tell you a little bit about that as well. So I'm not proud of the fact that I used to have a terrible diet, and I got away with it because I exercised a lot. So I used to think that I could eat whatever I wanted, because I was going to run it off. I was running marathons, I was running ultra marathons, and then subsequently to that, I was a cyclist, and I cycled at quite a high level, nationally, competing, and even going to a few international events. I was in a sponsored team, yeah, I was burning a huge amount of calories. But what I learned is you can't out-exercise a bad diet. So all we see when we look at people, and I do tell patients this, is the view from the outside. We're not seeing what they're doing to their arteries and their risk factors. And it wasn't necessarily my cholesterol that got me. My cholesterol was pretty high. It was above 6. But I got slower and slower on my bike. And I can laugh about it now. It wasn't funny. I had a really quite a large pulmonary embolism. I don't think that they believed it, certainly at work. I was duty doctor on a busy general practice day, and it suddenly crossed my mind that maybe this was the problem. And one of my colleagues took my took my blood, and it continued working. It came back later in the day, and it was really raised D-dimers, and yeah, I went in, had the investigations, and yeah, it was a significant pulmonary embolism. So I realized I needed to fix things, and I read a lot about what other athletes were doing, and lots of information about plant-based eating, and changed my life, really. So it was after this time, a few years afterwards, I went to a talk by somebody who may or may not be familiar to some of you. So Dr. Alan Desmond is a gastroenterologist at our local referral hospital at Torbay Hospital. And we invited him to give a talk to our GP trainees. In one of my other job roles, other than a GP partner, I also work for the training program for the GPVTS. I'm a TPD, which is a training program director there. And we got Dr. Desmond in, and I listened with a great deal of interest to his talk about gut health and plant-based eating. And it got me thinking. So that all happened in the background. And then I was in a somewhat fortunate position, as I mentioned, two of my job roles. I'm a GP partner in Barton Surgery in Dawlish, and I do the GPVTS. I'm a training program director there, so involved in the education of our future GPs coming through. And as part of my partnership role in the practice and being involved in the management of the practice, it was around that time that networks were being developed and were forming, and we needed somebody from our practice to be a clinical director or have our representation in the network as they were being set up. So it was a rather unique situation that I got the privilege to do this role. And I would say it's a job share role. There's me and two others. We have 3 practices in my network, and we have 3 partners, one from each of the practices, that has a job share clinical director role. I'm not quite sure that they realized what they were getting when they got me. Because I came to them and I said, I've got this great idea. I feel that as GPs, we really don't give a good lifestyle message. From my own experience, from what I'm seeing with patients, it's disheartening to see patients coming in. I've been a GP partner for more than 10 years now, and I've got to know my patients, and I see them getting older, and they come in with their high blood pressure, and they start their first medication, and then they get type 2 diabetes, and they start more medication, and then they get cancer 1, cancer 2, and we're just giving all this medication to treat it. And I wasn't sure there was a consistent message that we knew how to give to educate our patients in lifestyle and what they should be doing. And I really wanted to address this. So somehow I managed to convince the network to fund an event where I could invite a speaker, and we could offer education to health professionals about lifestyle changes that we should be giving to our patients, and have the conversations together. So we got Dr. Desmond to come and do a talk, and we also connected with the voluntary sector in our community. We involved them and some of the patient participation groups, and got the conversation going. And it was at that event that we held that Alan Desmond presented this challenge, the Southwest Plant-Based Challenge. And I also got him to come and talk to the trainers conference where we presented it as well. And just saw amazing results across the people that had done it, and realized how much fun it was, people doing it. And it was around this time that COVID was hitting. And so a few things happened then, is realize that actually we want to share this with patients, and how can we make it available to patients? And COVID's hitting, so I really wanted to develop a program that we could share this knowledge with patients, and it was going to have to be on Zoom. And could we use the network to do this? And I can talk a little bit more about that as well. So just as I've mentioned, I had Dr. Alan Desmond come and do the talk. Yeah, and we got amazing results, as I said. So in terms of the network and how we can use it, I'm a firm believer that if you want to make change, the best way to do it is from within. So if you're a coal-faced GP working, doing the job, you're seeing what's going on and you want to change things, it's from within, it's from being involved. It's from stepping forward and taking some leadership positions and management positions and trying to make a difference and knowing what's going on. So networks were set up to try and help, I think this is how they were sold, relieve the pressure on GPs and help patients as well with various services, and coordinate bigger practices to get more joined up services. Networks, I'm not sure if you're aware, but we have these roles, and the acronym's not the nicest. The ARRS, they're sometimes called the ARS roles, but the additional roles reimbursement scheme is the full description of them. And there's a list of roles, of job roles that we can recruit in the network. So I looked through these and I thought, there's health coaches there. Let's employ some health coaches and let's set up a program. And I didn't at that time really know how long it was going to take. It's taken us a good 12 months to get the program running. We've got a motivational journal, we've got workbooks, we've got information leaflets, we've got the 7-week set educational sessions, we've got recipe books, and it's really quite comprehensive what we've got now. And that's in many ways due to the team working on the project together and having a team to work on it. So the first role was health coaches. When we put the advert out, I was quite surprised at the interest that was generated, and in fact 2 GPs applied for the health coach role, and having an interest in having a health coach qualification and being a GP. It was a fantastic advantage for the team to get such talented individuals. And then it was later that the dietitian role came out, that we could employ dietitians. I think we were one of the first networks to employ a dietitian, and some of it was specifically to help with the setup of the WholeLife project. So yeah, it's taken some months to get it developed how we want it and to be running smoothly, but I'm proud to say that it is. And there's a waiting list for it. It's so popular. And this is with doing no advertising at all. Patients are actually coming in wanting it. It's through word of mouth that it's spreading in the community. And we're very much focusing on community change and cultural change. So we would like to see, support businesses that are offering healthy foods and activities in the community and work with the voluntary sector. And they refer people to us as well. Okay, and I've got a note right at the bottom there to say, I do put in a day a week so far, and my time is unfunded. So I am partially funded for my clinical director role as a job share with the other 2 clinical directors, but I am putting in more because I believe in it. I think it's probably one of the most worthwhile things that I've done with some of my time, and I think it's good for the patients. So I'm aware I'm probably talking longer than my allocated session. Sorry for that. I will speed up if necessary to get to any questions that you may have. But my top tips for affecting change in your world. So if you want to set up something locally or do something similar, what I would say. So I was going to tell you a story quickly that made a big difference to my life. And I heard it, and apologies if you've heard it before, bear with it, but I heard it about 10 years ago at a talk that I went to as a GP trainer. And it was a story about Gandhi, and he was walking through a remote village in India, and all the people thronged to see him and reach out to him. And through the crowds, a woman pushed her way towards him, and with her, she had her son that she was dragging behind her. And she got to Gandhi and she's like, Gandhi, Gandhi. And he stopped in his tracks and he turned to this lady and he looked at her and her son was clearly really overweight as a child. And she said, Gandhi, please, please, you've got to help me. Please, would you tell my son not to eat sweets? And Gandhi stopped and he looked at this lady and he looked at her son, and then he turned back to her and he said, I'm coming back through this village in 2 weeks' time. Come back then and see me, and I'll tell your son not to eat sweets then. So she was a little disappointed, and she walked off. But 2 weeks later, he was back through the same village, And there was the same lady again, and pushing through the crowds again with her son in front of Gandhi. Gandhi, do you remember me? And it's like, of course. He looked at her and he turned to her son, and he said to her son, don't eat sweets. And the mum was really pleased, and she's like, oh, thank you. But I don't understand. Why couldn't you have said that 2 weeks ago? And he turned to her and he said, I love sweets. And he said, I had to give them up first before I could tell somebody else to do that too, and make sure that I could do it. And that's why. And for me, listening to that, it was very much the message is be the change. So you're the role model in your communities, be that change that you want to see. So yeah, your enthusiasm, your passion will rub off in your practice, in your community. Yeah, and just being aware of that. So as I said before, I think that change comes from within. So it's important to be part of the team doing the coalface day-to-day GP work. It gives you an awareness of the issues, and it generates a lot of respect from your colleagues to see that you're all pulling in the same direction. You're aware of the pressures that everyone's under. Become involved. So find out how you can be involved in your network, go to the meetings, read the emails, the endless emails, if you're interested in it, and be involved in the decisions in a partnership or in a bigger network. If you can, involve secondary care. Look for friends there who may have similar ideals or want to pull in the same direction. It's really helpful to have colleagues. So we're fortunate in this area to have Dr. Alan Desmond in Torbay Hospital to link in with. Yeah, look for friends there. And really important, involve the community and your patients in the voluntary sectors. So when I started doing this, to my shame, I wasn't aware of quite how many services were available in the voluntary sector in the community. It's been an educational experience for me to just see how much good work is being done out there, and to link in with that has been excellent. Yeah, and I have to say it, avoid negativity and don't give up. So there are some people out there who do give a very negative message, and I can think of one colleague who said that he would rather continue eating processed one fast food chain burgers and taking a statin every day. And I was really, shocked, because I would hope that isn't a message that would be given to patients as well. But as I say, don't give up. You'll be amazed just starting at resources that come to you and things that you find out about. So just making a start. So putting those adverts out for the health coaches, and then having GPs apply as well, who, even now I'm being approached by people who want to join us voluntarily, who don't want a salary at all. They just want to be part of it. Jane mentioned our GP trainee who came. So I'm in the fortunate position to be part of the GP training scheme and the education team, and I put together what we call an ITP. It's an integrated training post, where somebody has the opportunity to be involved in management and leadership projects, as well as do some general practice. And that's how we had a GP trainee spending some time with the WholeLife team as well, and helping us develop resources, which was lovely. So yeah, aiming for that cultural change. I won't say too much more about that. Keeping it fun, keeping it real. All our patients really enjoy it. They love the social interaction. They love the support. And it's amazing that we have, as Jane said, there's some people who are athletes, triathletes, Ironman, and they're doing the same course as somebody who's type 2 diabetic, overweight, and they're all supporting one another and finding it fun and beneficial. I think quality improvement skills are really useful for gathering data. So if you have some of those skills, that's really useful. Look at your skill mix locally, use the team and offer to develop a team. You're not going to do it by yourself. It's really important to have that mix around you. And collect your results. Commissioners like data. So we, as a baseline, weight and blood pressure, that's where we see the biggest results. We know that people are getting their cholesterols done for a variety of reasons, whether it's their background chronic health conditions or whether it's things like an NHS health check. And then we have a standard information leaflet. They're given the options that are available to them. And one of those is lifestyle intervention, and they can sign up to our program. And the feedback that I'm getting from some of the people who've been involved, that was a quote from one of our health coaches: "It's the most satisfying and worthwhile thing I've done with my GP career." So being involved in the setup of this. So very lastly, and then I'll stop talking, is what are the options? So if you wanted WholeLife in your area, if you say, well, this looks great, I'd love to be able to offer it to my patients. So if you live in my network, so we have 37,000 patients, we are Dawlish, Teignmouth, Sheldon, then it's free on the NHS. The network has employed our staff to run the WholeLife course, and it's available on the NHS. If you're out of area, we can do it privately, and I was approached and asked by several patients right the way up from Glasgow to North Devon, who've done the course privately, who just want access to it and have wanted to do it, and we've run a small private course so that's possible. If you live in Devon, I'm working on this. There may be funding for a license for all the materials that we've developed to run the WholeLife course. So you could contact me if you're interested in something like that. So watch this space. And I am chatting to the commissioners about being able to take referrals from a wider area and be commissioned, because we are online and on Zoom. It would miss out on the local cultural kind of community influence, but it may be possible. So exciting developments are possible in the future, but it would also be possible for you in your own networks to, if you could convince them to employ staff to run these courses, to be running WholeLife courses or similar. Yeah, and we've had multiple contacts from people, GPs, health professionals who wish to work with us, just even free as a volunteer, to just be involved, which is lovely to see. Right, so.
That was absolutely incredible, Jenny. Thank you so much. Jane, are you able to turn on? Wonderful. Hopefully everyone can see us clearly. That was such an inspiring presentation. What you've achieved with your patients is absolutely incredible. And also your own story, your own journey was just thank you so much for sharing that with us and for two such wonderful presentations. So I do have some questions. I know we don't have that much time, but I will try and get through them all. One of the questions says, great program, thank you. Have you noticed an association between adherence to your recommendations and the health improvements seen?
Well, that's a good question. We don't. I showed you some survey results of before and after, and 1 6-month survey results. So we don't collect dietary data as such. We can't do that. We don't have the resources. But the survey data does touch on whether or not there's still, it's done at the end of the 7 weeks, so roughly 8 weeks. They fill in this survey, and they do report back to us how much out of us, a list of 5 different options they're following the plant-based diet, how much meat are they eating, or how often they're eating certain foods, meat, red meat, processed foods, and then we ask them about how they're feeling on a different range of health-related spectrums, of some of which I showed you, and so I would say yes, we do notice a correlation between what they say they're adhering to and how they're feeling, but it's only on a sort of a blunt score. It's not individual scores, so we don't collect data like that. We just don't have the resources.
That's really helpful to know. Yeah. And would you be able to tell us a bit more about the demographic that you're serving in terms of socioeconomic background, ethnicity, gender? Do you have that information to hand?
Again, go on, Jenny, sorry.
So being a coastal Devon town, we're not the most cosmopolitan kind of practice. So we tend to have a more retired, elderly population, and it's not a very wealthy area. The deprivation index is quite high in some of the coastal towns and areas. So there's certainly a high deprivation factor that goes in there. So more definitely a lot older than somewhere than a city centre. Even down the road, Exeter was a lot older population than that.
That's really helpful to know. And so part of the advice around plant-based diet has to be sort of catering to people on different budgets. And so, you know, the kinds of foods that you could eat and that would be affordable at different price points. Is that all factored into the information that your dietitians provide?
Yes, yeah, it's a question that we get asked quite a lot. And what's so lovely about the programme is some of the solutions are generated by the participants themselves, sharing information. So because we're linking them, they're like, oh, have you seen you can get this there or that there? And they're sharing resources of where they're buying it, and they're loving sharing that information and photos of it and things like that. So recently, in fact, they shared there's a refillery in Teignmouth where you can go and take your jars and get it refilled. And actually, if you're eating carefully, it can be a lot cheaper on a whole food, whole grain, plant-based diet compared to the processed things. So it doesn't necessarily have to be more expensive at all. But there's definitely dietary advice from our dietitians regarding that and sources.
Yeah, so our dietitians have actually produced a leaflet of an information sheet on that, and a comparison, a budgetary comparison of an example family plant-based diet versus family non-plant-based diet. And so we do pay attention and focus on that issue.
Wonderful. Do your ARRS funded staff work 100% on the programme or part-time?
So I think both Jane and I could answer that. I love how you said ARRS rather than the way other people say it. But yeah, so they work a variety of days for us. So both our dietitians work for the network 2 days a week. And one of their days a week is for WholeLife, and one is just for the network offering general dietitian appointments. And their remaining 3 days a week, one still works for the trust. So he actually works for the Tier 3 obesity services. Quite useful skills to have. And it's also useful for him to have a comparison about the success that they're having versus us, and the different, it's really interesting. Jane, do you want to answer about you?
Oh, I work 1 day a week, not on a GP salary, but that's a reflection of my passion for the subject. So
Jane is a health coach GP. So yeah, we can't employ GPs as networks. So no network can employ a GP, national decision, but we can employ a health coach. So Jane is employed as a health coach, and as Jane says, not on a GP salary, on a health coach salary. Thank you, Jane, for a day a week. But you do offer health coaching appointments for anyone on the course that wants it in addition, but it's WholeLife that you work on for 1 day a week. So you could say for WholeLife, we have a health coach, GP health coach, and 2 dietitians, and myself, and an admin person who's also a health coach and a health promotion person. Not to neglect her, who does some admin for the team, because actually there's quite a bit of admin behind in terms of contacting the patients, emailing them, and enrolling them in the course, but she's expert at that.
I can imagine you all wear many different hats, there's, in terms of the team being quite lean, but you have this incredible reach, and you're working with so many patients, achieving things, and just the number of resources that you provide them is quite incredible. So we have a lot of people, as you would imagine, for a webinar like this, and a lot of health professionals who joined to say, program sounds fantastic, and there's questions from a health coach and from a nutritionist who are asking how could they get involved with something like this, or would you have any advice for people in other areas who want to start something similar in their area? What would be sort of, if you had to give this whole presentation has been packed with amazing tips, but if you had to give sort of in a nutshell advice to people, who are looking to either get involved with this or start something similar, what would you suggest?
So I think if you want to get involved with WholeLife, then drop me an email. So I think our email contact details were there. As you say, we've developed as a team so many resources, and we like to think we've got some expertise now in delivering the course. So if it's something that you would like to see in your area, then let's chat about that. If you want to start from scratch doing your own thing, then I would say just go for it. It's a lot of hard work. And you do need to get your network on side, and you will be facing a few battles along the way, but just make a start, and use opportunities as they come up. So look at things and see how they could help you from the list of roles. I know that some networks are more functional than others, so there's been significant underspend with the ARRS roles, and some networks haven't spent their full budget. So if you know that you're in a network that's not very proactive, or that isn't achieving what it could do, well, it's time to make a difference. Tell them how you could make a difference, and maybe show them how you can reduce their workload. That's what GPs like, to know how we can manage workload better. So develop some resources that can give them options to refer their patients to, that will make a difference to their patients. And in terms of relations between the patients and the surgery, patients are so appreciative, and they're like, oh, this has made me see my GP practice in a different way. It's great feedback for practices, that they know that we really do care, and we're willing to give some of our time to showing this, and give them a different, it's easy, in some ways it's a lot easier to just give somebody a medication and send them out the door, but actually to take the time and say, well, there are other options, have you thought about this? Then people realize that we care about them, and we don't just want to give them medication.
You could see that in that lovely video of the gentleman that you'd help, just that power of connection, which I think came out through the presentation. So I'm just going to launch a poll to get everyone's feedback, and I've got two last questions to ask. One's a quick one. So the 23 millimole drop in blood glucose, was that for a patient with type 1 or type 2 diabetes? I assume type 2.
That was type 2, yeah.
So it wasn't someone with pre-diabetes, because you mentioned they actually had a bigger drop. It was for type 2 diabetes? Yeah.
Yes.
Okay. Great. And then the last question I wanted to ask was, obviously, Jenny, we heard your incredible story, but I wanted to ask Jane about yours in a bit more detail, about how you started your plant-based journey and lifestyle medicine.
Well, probably from two directions. One is an ex-partner. I was a partner in Wiltshire for 16, 17 years. For family reasons, moved to Devon and gave that up. Which was a wrench, but I realized looking back that how frustrated I was with medicine and family practice at the growing levels of multiple meds, multiple morbidities, increasing weight, increasing illness, and how we weren't really chipping away at it at all. And the second element of my journey is really to do with environmentalism and climate change, and became very aware of the emergencies, the dual emergencies, a couple of years ago, and actually have been a bit of a climate activist in recent times, but just have this passion for nature that has been there all my life, and all these things together just took hold of me, and I had a bit more time to think about all these things and think, well, how do I want to merge these passions and this desire to make some change, and met Jenny doing a locum job at her practice, and I think she instantly recognized where I came from and thought, are you interested? And we formed a good team. So I come from those dual roles of wanting to make a difference in people's health and wanting to make a difference in the planet's health as well.
I love that you tie that into the program's aims. I know that more and more GPs are looking at the planetary side of things, and obviously, you know, we need to be recommending dietary patterns that support planetary health. It's
Yes.
really important. So I love that that's such a big part of your program. I think it's so inspiring. And I think, you know, we've come to the end of the session now. I could definitely talk to you both all evening because you have such a wealth of knowledge to share. And I know that we'll do something again soon, but I just want to thank you both for such a wonderful presentation and for sharing so much information. I know so many people are going to be watching the recording. Again, recordings are available to all PBHP UK all PBH UK members. So thank you everyone for joining us, and I will send everyone the slides and the CPD certificate in a few days' time as well. But yeah, thank you again, and have a good evening, everyone.
Thanks very much.
Thank you. Thank you.
Good night.